Imagine a teenager who spent years relying on regular blood transfusions just to survive. Now, picture a world where that same teenager is free from those lifelong treatments thanks to a groundbreaking gene therapy. This isn't science fiction. It's happening right now. Children's Healthcare of Atlanta has achieved a medical milestone by performing Georgia's first commercial gene therapy transplant for beta thalassemia, a genetic disorder that once required constant medical intervention. But here's where it gets even more fascinating. This treatment doesn't rely on a donor. It uses the patient's own stem cells, reprogrammed to correct the genetic defect. Beta thalassemia is an inherited condition where the body can't produce normal hemoglobin due to a genetic mutation. While it's common in regions like the Middle East, Africa, Asia, and Southeast Asia, it's relatively rare in the United States. Dr. Jeanne Boudreaux, director of the Comprehensive Thalassemia Treatment Program at Children's Healthcare of Atlanta, explains that patients like 16-year-old Josh Dri typically need blood transfusions every 3 weeks to manage severe anemia. Traditionally, the only cure was a bone marrow transplant from a sibling donor, a near-impossible option for Dri, who is adopted. And this is the part most people miss. Instead of relying on a donor, doctors harvested Dri's own stem cells, cells with the unique ability to develop into various cell types, and sent them to a specialized lab. There, they inserted a normal copy of the beta globin, HBB gene, which is defective in thalassemia patients. After modifying these cells, they were reintroduced into Dri's body, following a course of chemotherapy to create space in his bone marrow. Here's the controversial part. While this treatment is a game-changer, it's not without challenges. Patients like Dri endure the harsh side effects of chemotherapy, including hair loss, mouth sores, and weakened immunity, before their bodies begin producing healthy blood cells. Is this trade-off worth it? And could this approach revolutionize treatment for other rare genetic disorders? Dr. Boudreaux believes this is just the beginning. Being able to show the success of this therapy is going to be important for genetic diseases, she says. Even though thalassemia is rare in the U.S., this breakthrough opens doors for treating other blood disorders and potentially genetic conditions beyond the blood system. So, what do you think? Is gene therapy the future of medicine, or are we moving too fast into uncharted territory? Let's discuss in the comments. Your perspective could spark the next big conversation.